Hi, my name is Alexis Nolasco. I'm doing my case study on mammography and breast cancer on Sheryl Crow. Sheryl Crow was 44 years of age when she was diagnosed with stage 0 breast cancer. In 2006, she almost canceled the mammogram that detected her breast cancer. Sheryl did not wait for another mammogram like her doctor requested. Instead, she went in for a lumpectomy. She is known as an actress and a Grammy Award-winning singer. Her lumpectomy included removing the breast cancer tissue and surrounding normal tissue. Thanks to her going to her annual mammogram, they detected the breast cancer early and were able to remove the cancerous tissue. She has been in remission for 15 years after 33 radiation treatments over the span of 7 weeks. So what is breast cancer? Breast cancer occurs when the cells begin to grow out of control in the breast tissue. The cancer cells will form a tumor that can either be felt as a lump or seen through an X-ray or mammogram, as seen on this slide in this picture is a mammogram with the breast cancer. Cancer can form in any part of the breast and be of various types and stages. The most common type of breast cancer is IDC, invasive ductal carcinoma. Biopsies can help determine the stage and type of cancers. Biopsies on cancers such as this one are tested in the lab to look for proteins such as estrogen receptors and progesterone receptors. This will help the provider determine the course of treatment. There are many risk factors to getting breast cancer, so being female alone is a huge risk factor. Women who have had any radiation therapy near the breast or the chest before the age of 30 are at a higher risk. Women with the genetic gene of BRCA1 and BRCA2 are also at a higher risk. Alcohol consumption and smoking contribute to the risk factors for breast cancer. Women who tend to be overweight or maintain an unhealthy diet are also at risk for breast cancer. Most women are diagnosed over the age of 50. Not all women who are diagnosed with breast cancer have any risk factors at all, and there is a 1% chance that male can also get breast cancer. Signs and symptoms to look for in breast cancer include dimple skin of the breast, bloody discharge or any discharge that doesn't include breast milk, nipple inversion, which is turning inside out of the nipple, any color change in the nipple or the areola, lumps in the armpit, lymph discharge, any visible lumps around or on the breast tissue, and a texture change. Some other symptoms and signs include swelling on all or part of the breast or nipple pain, irritation anywhere on the breast, and swollen lymph nodes. These are things to look out for and reach out to your provider if you see any of these signs and symptoms. So, a mammogram is used to detect breast cancer or tumors in a woman's breast. The mammograms are suggested for women older than 50 to age to be screened annually. This helps to detect early breast cancer before the woman should experience any symptoms. The mammogram consists of placing the breast between two plastic plates to hold it in place and spread the breast tissue while the X-ray is being taken. So this picture up in the upper right corner shows the camera unit and the X-ray beam coming down into the breast, which is being squeezed between two plates in order to capture the image. The mammogram uses low-dose X-rays to capture a two-dimensional image of the breast tissue. This results in superposition. This separates the different tissues in the breast, and the Mammotech uses two different views on each breast. One of which is the CC, it's called a craniocaudal view, and the MLO, medial lateral oblique view. This also allows the tech to visualize much of the breast tissue and pectoral muscle as possible, bringing that breast off the chest so they can see every piece of tissue between the tissue and the pectoral muscle. So there are many different treatment options for breast cancer. They're broken down into two separate categories, one being local and the other being systemic. So local treatments are surgical removal of the cancer tissue and external beam radiation using high energy rays to kill the cells. Systemic treatments include hormonal therapy in which they block the cancer cells from getting the hormones they need to grow. Then there is also chemotherapy where they use special medicines to shrink and kill the cancer cells. This can include taking pills or as such seen in the picture of chemotherapy, also given through the vein. Targeted drug therapy also uses drugs that enter through parts of the body to fight against the cancers that have spread to different parts of the body. Lastly, there is also biological therapy, and this works with the body's immune system to help fight the cancer cells and control side effects from other cancer treatments. Prevention can help reduce the risk of getting breast cancer. This includes doing regular self-breast exams using two fingers to palpate the breast and feel for any changes in either a circular motion or an up and down motion all the way across the breast. There are many ways to prevent just simply by staying active and keeping a healthy diet. Avoiding smoking and eliminating alcohol use are also good ways to keep a low risk. Many may have the breast cancer gene, but these people can be tested with special blood tests called the BRCA1 and BRCA2. These look for a possibility of breast cancer in the genes. Another way to help prevention is following the provider's request by doing annual mammograms to monitor the status of the breast tissue for early detection of breast disease. And results suggest that one breast cancer death is prevented for every 1,000 to 1,500 mammograms. Breast cancer is grouped based upon the stages of the cancer and the SEER stage. SEER stands for the surveillance, epidemiology, and end results. The localized SEER 5-year survival rate is at 99%. This means that no sign that the cancer has spread outside of the breast. The regional being at 86%, is cancer spreading outside the breast to the lymph nodes or nearby structures. And distant at 28%, this cancer spreads to distant parts of the body, including lungs, liver, and the bones. Over here in the picture showing the stages of breast cancer starting from 0 all the way up to stage 5. These are percentages that are based upon how far the cancer has spread. It does not consider someone's age, overall health, how well they respond to treatment. These two cupcakes represent two breasts with the nipples and areolas with the pink coloring. And over here, we have a larger breast with a tumor in it that we're going to dissect like a lumpectomy. And there's the cancer. And then over here, for a mammogram, what they'll do is they'll squeeze the breast together like so, showing the densities in the breast tissue. And voila. Thank you for watching, and I hope you enjoyed this presentation. The end.